8 or 9 years ago, we had about 55 or 60,000 medical seats. Today we have 1 lakh, nearly 1,10,000 medical seats in just about 7-8 years.
That's almost doubling up of the total seats.
What took nearly 70 years after the independence, right, to build this many number? It was done in 8-9 years. You cannot transform the healthcare of India without producing competent, adequate number of good doctors.
Hi guys, welcome to our podcast featuring an extraordinary individual in the realm of healthcare, Dr. Devi Prasad Shetty. Renowned as both an entrepreneur and as a cardiac surgeon, he stands as the chairman and founder of Narayana Health, overseeing a network of over 21 medical centers across the country. With a remarkable track record of over 100,000 hard operations, Dr. Shetty has been a pioneer in making healthcare more affordable. Recognized for his outstanding contributions, he's also been honored with Padma Shri and Padma Bhushan by the Government of India. So, let's see where does this conversation lead us with Dr. Devi Shetty. Thank you so much, Dr. Devi Shetty, for joining us today on New India Junction's podcast with Ananya.
My pleasure, Ananya. My pleasure.
And for the viewers, I want to tell them that we are recording this at 9:15 p.m. in the night because when I spoke to your secretary and I said we want to do a podcast, he said, at any given point, Dr. Shetty is looking after at least 100 patients waiting in a line. So what does it feel like? I mean, what is your state of mind when you have over 100 patients waiting to seek your treatment?
See, let me put it this way. They travel for 2-3 days to reach Bangalore. They come from, a lot of patients come from Eastern India, a lot of patients come from Bangladesh. Every day, if they delay, there is a huge cost for them to stay, inconvenience, and they come with little kids. You know how little babies to manage them in a guest house or a hotel. I feel bad. I feel awful. So I try to see as many as possible every day because just want to add, not to inconvenience them.
Right.
It doesn't make me feel good about myself or proud about myself. I feel bad that, they have to travel so long to see me. Yeah.
So what does your average day look like? I mean, yahan se shuruaat karte. Like, what time do you get up?
I get up by 4:30.
Okay.
And I exercise in the morning. I spend at least 1 hour of exercise. Then try to get back for work as soon as possible. Once I get into the hospital, then I have to be very, very careful with my timing because I need to see at least 60 to 100 patients every day. And in between that, I need to do at least one surgery.
Being a dil ka doctor, a cardiac surgeon, what do you do to keep yourself healthy? I mean, you spoke about exercise. Does an allopathic doctor like you, do you do yoga? Do you believe in...
Yeah. I'm a very, very strong advocate of yoga. It happened, I think, few years ago when I started developing pain in my knees. I just ignored it, but it was not going. My wife kept telling me that I should start yoga.
Yeah.
And I thought yoga is not for a person like me. I was always athletic. I was a bodybuilder. I used to practice martial art. So I thought it's not for me. But the pain didn't go away. Then finally I had a yoga teacher teaching me all the yoga exercises.
Okay.
Really, I think in less than a month, the pain disappeared from my knee. Today, if you ask me, that nagging pain you had over a year, lasted for a year, whether it's a right leg or left leg, I can't even remember. My life has never been the same after I started yoga exercise. I strongly advocate. I know youngsters like bodybuilding muscles. I used to have big muscles and I used to wear very tight t-shirts and show off. Bodybuilding is only to show off, but if you really need the strength, flexibility, you need to practice yoga. Yeah. You can have both.
Right. And do you think in the recent times there has been greater evidence-based understanding or recognition of yoga and other Ayush modalities, especially with a lot of government efforts? I mean, we have a dedicated ministry now. Do you think that has added to the scientific understanding and application of these, I should say, more natural methods or more holistic methods of healing?
Yes, I have. I am a. I am one of the greatest examples. My life has been a great example, and I swear by all my children, all of them. They're all young, fit people, very athletic, very athletic, and one is a black belt in karate. But all of them practice yoga. Yeah, all of them, and we strongly believe in yoga. And our diabetology swears by the impact of yoga on steady control of blood sugar. So there is no there is absolutely no doubt in our mind that yoga is the best gift India has given to the world.
Wow. Talking about your own journey, you started out as a clinician and were the top-notch cardiac surgeons in the country. And then we see that, there is a tipping point where you think about scaling up healthcare, you talk about affordable healthcare, and with the entire Narayana healthcare system spreading across 21 centers in the country. Was there a critical turning point in your mind as a clinician when you thought you wanted to do more and wanted to look at public health systems at large?
Yes, you see, I left England in 1989, and I started my career in Calcutta, and we established BM Birla Heart Research Center as a very premier cardiac institute. This is about, I think, 33 years ago. That time, heart surgery was just getting accepted. For me, the transformation was from Heathrow to Howrah. It is a major transformation. And I had the privilege of working with the Birlas. Then later I worked with the Manipal Group. Both, they are wonderful employers. I had a great time. They gave me a fantastic platform to excel and establish myself. But at some point of time, you realize that all your eccentric ideas, crazy ideas of changing the world, you need to have your own freedom and your own infrastructure which you control. That's how I never thought when I started my career, when I left England, that I will ever be owning a hospital. I just wanted to work in some big place and do something worthwhile. Looking back, no regrets, only good experiences. I'm grateful to all my previous employers for giving me the opportunity. But then you realize that you need to do something more than what you have been doing. You all have one life. And that is how I started. But I never thought we will reach this level. Yeah.
Okay. All right. You've seen and you've been a keen observer, both as a clinician, as a public health leader, even as a social entrepreneur. What big ticket changes in the public healthcare scenario have you seen India make in the past, say, decade or so?
See, the most important part of healthcare in India is the medical education. I think 8 or 9 years ago, we had about 55 or 60,000 medical seats. Today we have nearly 110,000 medical seats in just about 7-8 years.
Wow.
That is a massive transformation. Because, of course, for the country like India, it requires a lot more. But in just 7 years, 8 years, huge transformation.
That's almost doubling up of the total seats.
Yeah, what took nearly 70 years after the independence, right, to build this many number, it was done in 8-9 years. That is a major shift. And this is something which is very close to me, medical education, because you cannot transform the healthcare of India without producing competent, adequate number of good doctors.
Yep.
So that's a very important change. Then the other the government schemes, like there are large number of government schemes, including Ayushman Bharat. They're all phenomenal schemes. We can always complain that we are not doing enough. But on the whole, the business scenario for organization to build and expand, I'll give you one example. 17 years ago, I wanted to have a health insurance company. 16, 17 years ago. Those days, the regulator will not even talk to people like us. And about a year ago, I went to the IRDA office to come up with some kind of a model of not a health insurance, something like a health insurance, because I thought it's too big. I mean, we won't be able to get the license, and I have the license to start. Then they convinced me that India is now ready for business. You have to start a health insurance company. I never thought a time will come where you would say the babus of the government will come forward and talk to people like us and say that, this is the opportunity, you all have to take advantage of that. So these are unthinkable, because I have seen, I've been in this country for since I was born. So I have seen this massive shift happening. Now, when we look at the world, we don't look at India. We look at where do we stand in the global scenario? Where do we see like in my car, in the windshield at the back, there is one, when Chandrayaan was a successful venture, I put a sticker there that thanks to ISRO, I'm not driving, I'm moonwalking.
Okay. Yeah.
This is the typical feeling of most of the entrepreneurs in India. They're all moonwalking. Yeah.
Right. So, couple of questions on the healthcare piece. You mentioned Ayushman Bharat. And now we know what Ayushman Bharat is. It's been in operation for over 5 years. But if you were to summarize the impact of Ayushman Bharat from a public health perspective in a country as big as India, how do you see that? How impactful is it on the ground?
See, the number of people who are getting benefited by Ayushman Bharat may be small, but you must realize that no large country in the world is successful in offering universal healthcare to all the citizens. Like since independence, we have been talking about universal healthcare for free, and the government has to do this. We have to realize that what a Scandinavian country with a population of 500,000 could do, or like a government of Singapore, what they can do. We have studied the universal healthcare for free. All these countries have three common traits. They are all small countries. No big country has ever been able to offer healthcare to the citizens free of cost.
Okay.
And all these countries have a very high tax to GDP ratio. Some countries have 35, 45%. Our tax to GDP ratio is hardly 11.5% or something. Then they're all spending already more than 10 to 20% of the GDP on healthcare. So we are spending hardly 1.5%. We simply, even forget India, even United States of America cannot offer free healthcare to the citizens. It's not possible, even though they are the richest country in the world.
Yep.
So, but whatever limited means the government has, with hardly a tax to GDP ratio of 11.5%, this is the best we could do. Yeah.
Okay. Within Ayushman Bharat, now there is a progression towards Ayushman Bharat digital mission. We are talking about Aadhaar account numbers also, and the whole digital health infrastructure panning out. To the podcast listener who's not a doctor, not into public health, how would you explain what do you think the Ayushman Bharat digital health mission is going towards? And what opportunities does it hold for us in the future?
See, we believe that India will become the first country in the world to dissociate healthcare from wealth.
Okay.
India will prove to the world that the wealth of the nation has, or wealth of the family has nothing to do with the quality of healthcare the citizens will enjoy. And you may think that, okay, it's a very wishful thinking, but it's going to take maybe 20 years, 50 years. This is going to happen in 5 years.
Okay.
How this will happen? This will happen because of two major shifts happening. One is the digital platforms. It is a matter of time before all the hospitals in India will have an extremely advanced digital platform. And every hospital will become paperless and everything will get transformed into a digital platform with the built-in AI, ML, all kinds of tools. It will happen very, very fast. The second transformation is because of the health insurance. Health insurance for working class, poor people, and middle class, and the rich people. These two transformations will dramatically change the way healthcare is delivered. See, India is a very interesting country where we defy the logic of how the progress happens. See, we know countries, small countries with the GDP, the per capita income of some of the countries in near US, Caribbean, and a few other Scandinavian, mainly the Caribbean countries. Their tax to GDP is, so their per capita income may be more than the US citizens. But in these countries, half the people do not have data in their mobile phone. They use mobile phone only to talk. There is no internet because data is very, very expensive. You look at India, even the beggars have the data in their phone. They can keep watching any movies they want in their mobile phone. So we have gone from no radio to color TV with few hundred channels in 20-25 years. We have gone from no phone to the most modern mobile phone in less than 20 years. So for us, this transformation, we always link everything with the affluence, right? If you have this much of money, you are rich people. If you are middle class, poor people. But when the price of the product changes, then it doesn't matter whether you're rich or poor. That's exactly what India will be doing. Yeah. It's a great opportunity for everyone.
And as you said, India is unique in terms of finding its own rasta, its own path, and its own unique model.
Yes. We defy the logic and the past, the example set by others. We make our own rules and we ensure that we deliver.
Right. Talking about India's public health system, you were also part of the COVID-19 task force. As a clinician and, of course, as a public health expert, how would you rate, and now in retrospective, how would you rate Prime Minister Modi's management of the COVID-19 pandemic from public health perspective?
When the COVID struck, nobody knew what it is and nobody had an idea how to manage. And more than anything else, this is the first time in my professional life, or this is the first time perhaps in the professional life for any doctor. It is not the fear of patient dying. It is the fear of we dying. So you can imagine the frame of mind what all of us went through. The way the COVID was managed by the government policies, the way the medical community came forward, nursing community, everyone involved, and how the CSR activity started funding these activities. It is truly remarkable. I have no doubt that among all the countries in the world, India has handled the COVID much, much better than most of the wealthy countries.
Right.
You must realize that what is our population? You're not talking about 5 million, 10 million population. You're talking about 1.3, 1.4 billion people. Managing all these complexities of the COVID with the isolation and the lockdown and the medicines and the ICU beds, it is extremely complex.
Wrapping up on the COVID-19 management, given the way India made its own vaccines and the way it was scaled up in the country, do you see that India's vaccine story is almost a Harvard case study in making?
Whatever India has achieved with the vaccine production in a record period of time, scaling up the production so that everyone who needs a vaccine, they got the vaccine at the right time. It's an amazing story, no doubt about it. Yeah. But see, of course, we have to be grateful to our pharmaceutical industries, which have a tradition of being vaccine manufacturers for the world. But the way it was scaled up is truly remarkable. Yes.
What do you think about the Jan Aushadhi stores? What ground level impact, because you've been working on affordable healthcare, and especially for people coming from low socioeconomic backgrounds. Do you think the life of an average Indian can really change with the Jan Aushadhi stores scaling up in the country?
See, the Jan Aushadhi by itself may not be having a huge impact the way it should have. Primarily because the way healthcare of the country is designed. In US, doctors cannot prescribe branded drugs. They have to prescribe generic drugs. Similarly, I think even in England now, doctors can't prescribe branded drugs.
Okay.
But in India, it's a tradition of prescribing branded drugs. Now, this causes a challenge predominantly because when the doctor writes the name of a particular drug and they are given a substitute, they will never be happy. The question is who has to decide on which brand to give, because there are so many brands. So at the moment, it is a step in the right direction to give a message that it is a matter of time before doctors will be asked to prescribe only generic drugs. It is the right step. And we have a long way to go, but it's going to happen.
We spoke about Jan Aushadhi stores and generic drugs. Now, talking about the future and talking about healthcare sector as a sector of the Indian economy, what are your projections, or where do you see India's healthcare sector going in the short to medium term?
See, as I said earlier, I have no doubt that in the near future, everyone in India will have access to affordable healthcare, predominantly funded by financial intermediaries called the health insurance or whatever. This is going to happen. When that happens, the entire dynamics of healthcare will undergo change. First thing is, when the number increases, cost of healthcare will come down dramatically. Cost of medicines will come down. Cost of equipment will come down. It is mainly the economy of scale. When that kind of a transformation happens, as the cost keeps coming down, the health insurance premium goes down, more and more people can buy the health insurance.
Yeah.
So it will reach a virtuous cycle. And we are just reaching, I wouldn't say that we are somewhere very close to it. Now, few million, it's very simple. Ananya, in India, 100 million families can afford to pay the premium for any health insurance.
Okay.
Whatever be the premium, they can pay 100 million families. Another 100 million families are working for the first 100 million families. Their driver, their maid, their the gardener, the people who are supporting them. And as you know, in India, largest number of employees are in unorganized. These unorganized sector is predominantly owned by the first 100 million people. So when the first 100 million people help the second 100 million families to buy the health insurance, partly funding it and partly encouraging them to buy health insurance, then we are left with maybe another 50 million families who are already taken care by the government.
Okay.
So the future of the healthcare in India will be huge. It will be dramatically different than what you have ever seen in any part of the world.
Wow. And we started with the entrepreneurship, and you spoke about how the environment has changed, right? Of course, with your clinician hat, but also with your entrepreneur hat. Tell me one key catalyst, that, say, Prime Minister Modi government has brought into the entrepreneurial space, which you think is encouraging young and old entrepreneurs alike to really, break the glass ceiling and innovate and scale up solutions that are contextual for the country.
See, today, every industry has to become digital. And maybe it's because Mr. Modi is a very, very tech-savvy person. The government's investment and the interest in digital platform made a huge, huge difference. You look at the UPI payment.
Right.
I think last 1 year, I haven't been carrying my wallet.
Yes.
I pay everywhere through one of those payment applications, right? And this has a huge impact on the way the working class people earn their money because of the ease of paying. Like, I pay today my drivers and my whoever is working with me lot more money than when I used to pay when I was carrying a wallet.
Okay.
When you're carrying your wallet, okay, you want to give maybe $500, you don't have the change, right? So essentially, it's always, okay, let me do it tomorrow. Today, everything it happens the moment you want it. So essentially the platforms which are available and the approach of the government in trying to digitize more and more of these activities has really set the tone for the private entrepreneurs to take up. So it's a matter of time. Every industry in the world will become a software industry, whether it's a healthcare industry, manufacturing, whatever you are doing. And we in India are really, really privileged because we are surrounded by great software engineers who can do amazing products.
Right. By the way, just a off the script question, have you met Prime Minister Modi in person? And is there like any particular memory or any particular impression that sort of really went down your heart and sort of inspired you?
I had the privilege of meeting him a few times when he was the chief minister. The first time was, I was involved in a insurance scheme called Yashaswini, and
Right.
I was explaining to him through a video call what Yashaswini was. That's long, long ago. Then I was making a presentation to him in his office, and I distinctly remember I had a pen drive, and I was trying to show the presentation in his office, and his assistants who are tech-savvy kids, they're trying to fiddle around. So we are waiting, and it became an uncomfortable 5 minutes and 10 minutes. He got up, he took them aside, and he fiddled around and made sure it worked. I don't know what he did.
Wow.
Realized that, okay, this man knows what he's doing.
That's
Who's expect a chief minister of a state to be so tech savvy?
That is genuinely tech savvy in practice then. Yeah. All right. Great. So before we wrap up, give us some tips to protect our hearts and have good heart health.
Yeah. Okay. The first of all, you are what you eat.
Hmm.
Okay. So you have to have a very balanced diet. Okay. And everyone thinks that oil is the villain.
Ah.
It is the carbohydrate which is the villain. That's the rice, chapatis, and everything, and the sugar, of course. Uh, Everyone has to exercise, and I recommend everyone to wear a smartwatch. And ideally, you should walk 10,000 steps per day. Earlier, we used to tell the patient that you have to walk half a minute, half an hour, 1 hour. Now we always specify that you walk 5,000 or 10,000 steps. 10,000 steps has a magic in your life. It will have a massive impact on the way your body functions.
Okay.
There are a lot of articles, scientific articles, proving that 10,000 steps has a big impact.
Hmm.
Everyone has to go through a preventive checkup at least once a year or once in 2 years. And every Indian past the age of 40, if they have a family history or if they're living a stressful life or a diabetes, they must go for a test called CT angio to find out whether there are any blockages in the heart. Then, more than anything else, I want everyone to become spiritual. That is very important. I'm not saying you should become religious.
Ah.
You should become spiritual. You see, the knowing that somebody above us, you may call it as a cosmic force or a god or whatever you call, is a very, very soothing force, especially when we are leading a very stressful life. Someone up there will make sure that right thing is done. Is a very, very a balancing force. So I recommend everyone to be spiritual.
Wonderful. I think these tips are great, and everybody who's recording with us has been nodding their heads and taking notes, I think. So thank you so much, Dr. Shetty. We will let you go because I know that you have other meetings lined up again at 10:30 in the night. But it was lovely talking to you, and we hope that we can talk again soon and continue to inspire us all as you do. Thank you so much, sir.
Thanks, Anna. Thank you. Thanks.
So that's a wrap up to our episode dedicated to public health and the changing Indian paradigm. If you like this topic or want to hear more about other such topics, let us know in the comment section. And get ready for our next episode where we get you some new flavors from Bihar and Jharkhand. To know what exactly I mean, join us next time. Till then, take care.